feel like it would be hard to eat because you're just like.
Mm-hmm. Perfect.
But so the only thing is on my end, because I don't have like the full Zoom, membership, I only have the basic one. So they're gonna like only record so much. I'm not gonna get the whole video unless you can send me a copy of yours later, Teresa.
Yeah, I will definitely.
All right, cool. All right, so I'm gonna hit the record. Oh, it says, please ask the host to give you permission. So unless you just record the whole thing and then you can just send it to me later.
So then, yeah, I'll do that. I'll record the whole thing.
Okay, sounds good.
Mm-hmm.
All right, so my name is Cindy Jovanovski. I'm the president of the Metro Fibromyalgia and CPS support group in Garden City. I'm just gonna go ahead and read the rules and then have our speaker introduce herself to everybody. So I'm gonna read the mission first. Our mission is to help others help themselves live happier, healthier, and more productive lives. We accomplish this by providing articles, newsletters, books, and speakers that focus on fibromyalgia. While we often have input from respected professionals, we are not medical professionals. We are fibromyalgia survivors. Information should always be carefully reviewed with your healthcare provider. Our goal. Our group has shared many ideas and information with all of you. Some of you may have found interest in them while others not. That is okay. We think it is important to remind you what this group is about. We are a support group. We talk and share our thoughts and ideas. We have speakers each month and also have provided a second meeting on the fourth Thursday each month for you to share. We do not endorse any products. It is for information only. We do like to hear what is working for you. Maybe others will try what you are doing. We try to make the meetings as positive as possible. Remember, what works for one does not work for all, but it is our duty and goal to bring the information to the group so you can decide from there. So now I'm going to introduce, I don't know if I should call you doctor or just Teresa McKelvy from the TMS Neural Care Centers in Chicago.
That's Teresa.
That's Teresa. Okay, go for it. Welcome to our group, by the way, and thank you for joining.
Perfect. Thank you. Well, thank you so much for that warm introduction. I would first like to say thank you, Cindy, for inviting our organization to be a part of your speaker series for your support group. It definitely is an honor and a privilege to be before you guys today. So what I've done is I have invited our Marissa Franson. She's our senior TMS therapist and our trainer for all of our other TMS therapists. So I've asked her to join us today so that she can yield, just kind of fill some of the questions that you guys may have about TMS towards the end. We also have Alyssa. Alyssa is one of our TMS therapists that's in the office with Marissa. She can always answer some questions as well. And I am delighted to see that we have our biller, Carrie, on the call. I wasn't expecting her. So Carrie, thank you so much for joining us today. And like I said, it's just an honor and a privilege to be before you. So what I would like to do is at the end, Cindy has allocated some time for questions and answers. So if you guys can write down any questions that you may have and ask those at the end, and then myself, Marissa, and Allie can answer any of the questions that you guys may have. But what I would like to do, if you guys don't mind, is when I start sharing the screen, I would like to turn my camera off, because I would like for you guys to be able to see the graphics, because some of those graphics are really important and they'll be a little smaller if we're sharing my screen. So I just want to make sure that you guys can see it, if that's okay.
That's no problem. Thank you. Oh, and hi, Dorothy. Welcome to our
Hi.
call. Nice to see you.
Thank you. You too.
Hi, Dorothy. Beautiful smile. Thank you so much for joining us.
Thank you. Glad to be here. Thank you.
Perfect. And I see you wearing your purple.
Yes. Yes. I like that. Yeah.
Yes, absolutely. And I just saw that one of our other TMS therapists, Jordan, has joined us out of our Oak Lawn office. So, Jordan, can you hear us?
Yes. Can you hear me?
Yes, I can hear you. Thank you so much for joining, Jordan. We really appreciate you being here.
Of course.
So it's nice to see the Mindful TMS team representing. So thank you so much for that. So what I'm going to do is I'm going to share my screen and I'm going to go ahead and get started. So we'll go ahead and if you guys have any questions, just kind of ask them at the end and I'll be right back with you in a second. Can you guys see my screen?
Yes.
Perfect. All right, so let me try and minimize you guys. Perfect. There we go. So, all right, so let's get into it. So once again, I am Teresa McKelvy, and I am the Chief Operating Officer for Mindful TMS. I am also over marketing. And so TMS stands for transcranial magnetic stimulation. It's a treatment protocol for patients that are suffering from depression, which is major depressive disorder. Also, people that are suffering from fibromyalgia suffer from depression as well. And we'll talk about that a little further in the discussion. So it's also approved for patients that are suffering from obsessive compulsive disorder, which is the OCD, and smoking cessation. So that's just to provide you with a little bit of context. So however, today we'll be discussing the benefits of TMS and how it can help people that are suffering from fibromyalgia. So, okay, there we go. So then I'll talk to you guys a little bit about TMS. Well, for those of you that are on the phone, I think well, not on the phone, on the presentation, I think there are a couple of you that may, well, especially for my team, they may not necessarily understand, fibromyalgia. So it just simply means muscle pain and things of that nature. So it's a disorder that affects the muscle and the soft tissue characterized by muscle pain, widespread pain, fatigue, their sleep disturbances, and so many more. So what I'll do is I'll talk to you a little bit about TMS. So it's non-invasive, it's non-systemic, meaning there's nothing that enter into your bloodstream. So there's no anesthesia, there's no cognitive impairment, and we treat TMS in an outpatient setting in one of our clinics. So there are minimal side effects. It eliminates the systemic side effects experienced by medication, and it's very beneficial for patients that are treatment resistant with insoluble side effects, patients that are having adverse reactions to medications, things of that nature. These are the kind of people that benefit from TMS. So another thing that you guys can understand is that it's cleared by the FDA in 2008. It was cleared by the FDA in 2018 for OCD, and cleared for 2020 for smoking cessation. So it was just cleared for smoking cessation last year. So the good thing about TMS being approved for smoking cessation is it's the same entry point for all addictions, whether it's opioids, alcohol, gambling, and eating disorders. All of this is caused by the addiction. So this is a huge win for people that are suffering from addictions. So now the other thing is it is covered by all major insurance companies, but only for major depressive disorder. Patients that are suffering from mild or moderate depression have to pay out of pocket. And there are very few insurance carriers that will cover it for OCD. So the treatment for fibromyalgia is considered an off-label treatment, and it's an out-of-pocket expense for patients. So once again, out-of-pocket for patients that are suffering from fibromyalgia. So what do we know about chronic pain? So my screen is not moving. What do we know? There we go. So what do we know about chronic pain? So chronic pain has a different pathophysiology as compared to the acute pain syndromes. All right, so it's associated with plastic changes in the nervous system, leading to the phenomenon of central and peripheral sensations. So the central involves like that increased pain sensitivity, and the peripheral is what reduces the threshold. And that's why people are experiencing so much pain. It intensifies and excites, and then it reduces the threshold. And then in chronic pain, usually there is no or little peripheral damage like injury or inflammation. It's a result of the nervous system dysfunction. And that's one of the reasons why diagnosing fibromyalgia is so difficult, because of some of these things. It's very difficult to diagnose fibromyalgia. Sometimes patients take a long time to kind of figure out that that's exactly what they have after going through so many different, you know, doctor's appointments or another one and running so many different batteries of tests. It kind of takes a while before someone can identify whether a patient is suffering from fibromyalgia or not. So chronic pain, it's a result of a maladaptive plasticity, you know, basically meaning it's the plasticity in the nervous system that leads to the disruption of the function and may be considered as a disease state. So what don't we know about chronic pain? So let's discuss the individual variabilities of why some individuals develop chronic pain and others don't. So fibromyalgia can be hereditary. So that's why you see the nature versus the nurture. So nature means your genes, you know, what you inherit from your family. And the nurture is basically the things that you can develop. You know, you can develop chronic pain from your environment. So is there specific neural circuits associated with the different chronic pain syndromes? So the resolution of neuroimaging tools is not sufficient. So it's possible, so we ask the question, like, is it possible to cure chronic pain? So we'll discuss that a little bit further during the presentation. So what we're going to be talking about is brain stimulation for treatment on pain. And as you can see here, here's an article dated back to 1959. So you know that brain stimulation is something that's not new. All right, so we're going to talk about how to revert the nervous system dysfunction associated with chronic pain. And the image on the right, so this is one of the reasons why I wanted to turn my screen off, so you can see, well, not my screen off, my video off, so you can see, you know, some of these images. And this right here, basically, the image on the right is basically an image of the nervous system. So we're going to start from the bottom. So here is TENS. So what we'll do is I'll tell you a little bit briefly. So there are various stimulation technologies currently available that will assist with treating chronic pain. And so these are some of the treatments that you have for patients that are suffering from chronic pain. So right here at the bottom is the TENS, which is the transcutaneous electric nerve stimulator. So it treats the pain in the spinal nerve. So this is a non-invasive treatment. So this is non-invasive, something that's topical. So then there's the invasive, you know, there's the spinal cord stimulator that treats the pain that's in your spinal cord. And so then here we move up to the vagal nerve stimulator. And that's another invasive treatment that treats the pain in the vagus nerve. And then we'll move here to the deep brain stimulation, which involves some implanting of electrodes into certain areas of the brain to generate like electrical impulses that control the abnormal brain activity. So that's what you have over here with this deep brain stimulation. So that's a little bit different than deep, you know, deep TMS, but there's like the deep brain stimulation, and that can be invasive as well. And so now let's discuss the cortical stimulation, which is, there are non-invasive and invasive techniques. So TMS is a non-invasive technique. So we target the motor cortex because of the neurotransmitters that are involved in both the pain and the depression. So that region involves the norepinephrine and the serotonin. So we target the area to cover those two conditions at once. We want to tackle the fibromyalgia with the chronic pain and the depression. So now most patients that are suffering from fibromyalgia are treated with Cymbalta. Like Cymbalta stabilizes the serotonin and the norepinephrine. Other drugs only target one or the other. So there are studies that show that patients have a higher rate of efficacy when TMS is combined with medication. So a lot of physicians or TMS therapists that treat for TMS therapy, they also have patients that are taking Cymbalta. So here's the non-invasive technique of the cortical stimulation. So what we do when we're treating patients that are suffering from fibromyalgia, we treat them with the repetitive transcranial magnetic stimulation, which is the RTMS. The R stands for repetitive. And what this is here is this is the TMS coil. So when we turn that TMS coil on, you can see this here. It creates that magnetic field, and then it releases the electric current, that electric field. So this area here, this is the motor cortex. So that's the area that I just mentioned that treats both for fibromyalgia and for depression. So they place the coil here on the motor cortex to treat, because that's the focal point for fibromyalgia and depression. As you can see here, here's this like orange reddish little circle. That's the dorsolateral prefrontal cortex. This is the first region to be approved by the FDA to treat depression, because that's the area that's most implicated in the pathophysiology for depression. So that's why we have that there. So now we'll talk about providing TMS. So this is what the device looks like for repetitive TMS. So the thing that sets us aside from our competitors is that we offer a neuronavigated targeted TMS. So we use this technology to determine the coil placement for optimum accuracy. So there's a study that shows if a coil is off even like 3 millimeters, it will affect the efficacy of treatment. So then there's another study that shows like 6 out of 10 patients that undergo TMS have the coil placed in the incorrect spot. So at Mindful, what we do is we offer neuronavigation because we want to take the guessing out of our treatments. And we want to make sure that the coil is placed in the correct area to achieve the optimal results every time. So now if there is anyone who would like to receive those articles, at the end, I'll make sure I put my email address in the chat, and anything that you want here, you can always send me an email or send Cindy an email, and then I can forward any of those things to you guys. If you want to see any of the articles and studies that we have, I'm always willing to give those to you. So next, just to tell you a little bit about the treatment session itself. So now the first treatment is a little bit lengthy. You may be in about an hour because we have to do what's called like determining the motor threshold. So those appointments are a little bit longer depending on what your motor threshold is. But each session itself lasts about 18 minutes, and we schedule each patient out in 30-minute increments. So now how it's delivered with that magnetic coil is pulses are delivered in groups of 4 seconds. And four in every 11 seconds, I apologize. It's delivered in groups of 4 for every 11 seconds, meaning there's 4 seconds of magnetic stimulation on the brain, and then there's 11 seconds break. So then it's 4 seconds of stimulation, 11 seconds you receive a break, and then 4 seconds, 11 seconds you receive a break, and then they repeat that for the 18 minutes of the treatment. And so a typical course is 5 times per week. So our patients come Monday through Friday for 4 to 6 weeks for 20 to 36 sessions, depending on what condition they have. So I know that sounds like a lot. And typically, you know, it's discouraging when you see, hey, I have to come 5 days a week for 4 to 6 weeks. But I promise you, it's worth the investment. It's worth the time, because there are so many people that have been experiencing, you know, chronic pain for so long, or been experiencing depression for so long. And I know there have been so many, you know, disappointments with not receiving the correct treatment, that I promise you, trying TMS is definitely worth it. So now I'll talk to you a little bit about the neuronavigation. So neuronavigation is typically used in an academic or hospital setting, and we're like one of the only clinics that offer neuronavigation in a clinical setting. And the reason why we do that is because of the previous study that I just told you about how some of the patients have the coil placed in the incorrect spot. because typically what they do is they place the coil on the motor cortex, and then there's like this little 5 centimeter rule to where once you determine the motor threshold, they take the coil and they place it like 5 centimeters forward to treat. And of course, you know, everybody's hair is different. So we just want to make sure that we are achieving the best results for our patients. So here we have the neuronavigation targeted TMS, which aims precisely at the Brodmann area 46 for depression. And it aims at the motor cortex, which is the M1 for fibromyalgia. And then here, what we do is we use an MRI database to effectively locate the patient's own brain anatomy to select the optimal results for treatment. And the reason why we do this is because there's greater precision, it yields better results, there are minimal to no side effects, and it enhances the patient comfort because we're not placing the coil on the incorrect spot. So I just wanted to go over this again here and talk to you a little bit about this to kind of show you a simple image to reiterate how TMS works. So as you can see, we talked earlier about the coil releasing the magnetic field. And you place it on the brain and it releases that electric current. So again, this is a non-invasive treatment. So it's not to be confused with ECT, which is the electroconvulsive shock therapy. I know people, that's the first question that people typically ask. They ask, oh, is this anything like shock therapy? It's nothing like ECT at all. So ECT will leave you with cognitive impairment and TMS does not. So with TMS, it's outpatient. You can drive yourself to and from work. Most of our patients come you know, before work or on their lunch break, and they're able to do that because this is it doesn't leave them with any cognitive impairment. Now, don't get me wrong, you know, ECT, let me go back here. ECT can be good for some people that are treatment resistant. It really has worked for a lot of people. But I would like to try a non-invasive approach first because it gives you a better quality of life if you're going through a non-invasive treatment versus an invasive one. So I would suggest strongly, of course, I'm an advocate for TMS, but I would strongly suggest trying TMS before someone would try ECT. So right now, TMS is listed as a third option behind pharmacology, you know, and ECT, but we wanted to start being considered as a first option. So this way, you're not having to worry about going through, you know, multiple failed medications, a whole bunch of side effects from those medications, and it's just an easier option to consider. So now I'll talk to you a little bit about this STAR-D study here. So the overall goal of the STAR-D study was to assess the efficacy of depression treatments in patients. So this is one of the longest STAR-D studies. So I want you guys to take a look at this graph. So it clearly shows how patients' chance of finding success with the medication decreases once they fail the first one. You know, so overall, antidepressants or anti-anxiety medications have like less than a 40% rate of success, but it's still the first line of defense when treating patients. You know, because as you can see here, 27.5%, and it just starts to decrease. It just starts to decrease. So TMS itself, TMS has close to 60% rate of success. And again, there are no intolerable side effects affiliated with TMS. And so that's why we try to advocate for it. So we'll take a look here at this current density magnitude. So this image is showing the brain activity when it receives electric current. So the electricity activates the neurons to regulate the abnormalities in the brain. So that's what you're seeing here. You're seeing that once that electric current goes into the brain, it creates the activity. And that electricity is telling those brain cells to wake up. So that's basically what you're seeing there. So here, as you can see, fibromyalgia and depression. it kind of goes hand in hand. And treating depression is something that we do well. So you see fibromyalgia, sleep apnea, obesity. Let me make sure. I think someone is trying to come in. I apologize for stopping. I needed to let those people in. All right, there we go. I apologize. I see there's some more people that came in, so thank you guys for joining us. All right, so now we're talking about fibromyalgia and depression and the synergies that they have. So fibromyalgia, sleep apnea, obesity, and depression kind of goes hand in hand. And then we'll talk a little bit about some of the synergies between these four conditions. So there was a study that shows that obesity is a comorbidity to fibromyalgia. So it also disrupts the sleeping patterns that leads to like the sleep apnea. So some experts are suggesting that weight management should be included in the treatment of fibromyalgia because being obese contributes to greater pain sensitivity, especially in the lower back area. But not only should we get the obesity under control, I also think depression is another thing that needs to be under control, and then especially sleep apnea. Because of course, if you're having disruptions in your sleep, you know, the biggest thing is your body isn't able to metabolize your food properly. And that's one of the things that's leading to the cause of obesity. Now, I'm no expert on sleep apnea or anything like that, but I do know there are some people that have it in my family. And I know that that's one of the things that contributes to their obesity is them not being able to get the proper good night's sleep so that their body can metabolize their food properly. And so here, this is the M1 stimulation for chronic pain. The M1 just basically stands for the motor cortex. That's what we were talking about a little bit earlier. So this is the only area on the brain that will treat both the depression and the pain. So the coil stimulates that cingulate gyrus for the depression and the thalamus for the pain. That's why we stimulate on the motor cortex for the fibromyalgia. We want to stimulate these two areas because we want to make sure that we are able to help patients that are suffering from fibromyalgia and chronic pain and the depression as well. So that's what we discussed earlier about that serotonin and things of that nature. Those are the two areas that it targets, and that's what yields the optimal result for the fibromyalgia. So here too, we're going to go into a couple of clinical studies so you can see some of the results for fibromyalgia. So as you look closer, this was a crossover study in which 60 patients received 2 rounds of TMS. So the first round, the coil was placed on the dorsolateral prefrontal cortex. And the second round, the coil was placed on the motor cortex. So as you can see down here on the second round, the patients had a greater reduction in their pain, greater success when you target the motor cortex versus the dorsolateral prefrontal cortex that everybody is known, is so popular. And they try with the dorsolateral prefrontal cortex first because that's the area that's most implicated in the pathophysiology of depression. And so since we know that depression and fibromyalgia go hand in hand, they targeted the dorsolateral prefrontal cortex first to see what the outcomes would be. And then they moved the coil over to the motor cortex. And as you can see, here, it yielded greater results. So these results that you see are the reduction in the symptom severity and not the amount of patients that receive relief. So here are some of the long-lasting effects of the TMS. So this was a last-minute ad that I thought was worth an honorable mention for you guys. So it's a study with 48 post-stroke patients that received a reduction in their pain severity from 5 consecutive sessions of rTMS. So as you can see, here are 4 separate studies with patients suffering from 2 different kinds of pain. And TMS reduced the pain severity in each case. So the first study that I showed you were patients that were suffering from fibromyalgia and chronic pain. And this study here is the post-stroke pain. So as you can see, like I spoke with you guys earlier about how the smoking cessation was approved by the FDA, and smoking cessation is addiction. So whatever the target entry is going to cure that, well, remission for that person, whether it is the eating disorders, alcohol, things of that nature, the target entry is the same. So it rings true for this as well. As you can see, they targeted that motor cortex for patients that were experiencing fibromyalgia and chronic pain. They targeted the motor cortex for patients that had the post-stroke. Because it's the same entry from pain in the brain, as you can see, there was results with TMS in pain. So now, they're redesigning TMS technology. And so now there is a new coil, that's available. Here we have this coin-shaped coil. So at Mindful TMS, we're not married to a brand. We're married to the science, and we're married to technology. So we're one of the few clinics that offer 3 different kinds of TMS devices. And so we do that because a patient may respond differently to a different TMS technology. So patients that suffer from comorbidities, typically what we do, we start them on a general protocol that will penetrate deeper and cover a wider range. And then however, a patient that's suffering from a single condition, we take a more targeted approach with the repetitive TMS. It's kind of what we do. And so the good thing about this new coil here, this cone-shaped coil, this is great news for patients that are suffering from fibromyalgia and chronic pain, because this cone-shaped coil allows for a deeper penetration to provide a balance to the singular gyrus and the thalamus. So this might actually be a game changer for fibromyalgia patients, and hopefully we can do some more clinical studies to have better results, so this way we can pressure the FDA into clearing TMS for fibromyalgia and chronic pain. So, gotta give you the disclosure here, of course. So although there are some encouraging results, neuromodulation for chronic pain is still a relatively unexplored field, and conclusions regarding its clinical effects at this stage are not yet possible. But we will continue working, and we will continue doing the clinical trials because it has shown some promise. So what I would like to do is I would like to talk to you guys a little bit about depression, because as you know, people that are experiencing fibromyalgia and chronic pain also experience depression. So I have a 3-minute video that I would like to show you guys. And so then we can move a little bit further into the presentation. So give me 1 second and I will show that video to you.
Literally like native seeds. And you just get a small donation, and it's you can plant it yourself, so it's not like a fully grown melon or corn or whatever, but you can
There we go. Can you guys see my screen?
native people. Oh. Yeah, I'll take a picture actually in the chat. It's still active right now. Yeah, the chat's still active. Yeah.
Can I have you guys to go on?
On the surface, a depressed brain looks much like a healthy brain, but inside the differences are unmistakable. During depression, the brain isn't operating at full strength in the area responsible for emotion. Think of it as the brain's emotional control center. The emotional control center delivers signals along the neural pathways to and from the areas of the brain that determine how we act, react, and respond to situations, thoughts, and feelings. In a depressed brain, they have become less active, or even inactive. In other words, signals that would normally regulate mood and emotions do not work properly in depression. This affects the brain's ability to naturally decode, evaluate, and react to what's happening around it. MagVenture TMS therapy is a safe, FDA-cleared, non-invasive treatment that uses short magnetic pulses to target the exact areas in the brain affected by depression, stimulating and strengthening these neural pathways. Like training a muscle, over time the inactive signals begin firing and reconnecting properly again, and thus restoring the emotional control center.
All right, I hope you guys enjoyed that little bit of video that we had there. So let's see. Take you back into the presentation. Can all of you see my screen? Can you guys see my screen?
Yes.
Perfect, thank you. All right, so I'll talk to you guys a little bit about depression because as you know, remember the pyramid that I showed you earlier where it had the depression in the center, you know, of fibromyalgia, sleep apnea, obesity, and depression. So patients experiencing fibromyalgia should not just get their weight under control. We think they should also control their depression as well. So we're definitely an advocate for that. So the brain region targeted with the H1 coil is the dorsolateral prefrontal cortex, which is the region for many years to be centrally implicated in the pathophysiology of depression. So the modulation of the dorsolateral prefrontal cortex, it induces, whether it's induced by the H1 coil, is combined with the individualized procedure and continued pharmacological and physiological treatment, which will allow effective treatment for millions of patients that are depressed. So this is simply a graph for the depression, and it shows you the response, you know, and the remission rates. And so, of course, people that respond positive to TMS are just basically people who may not necessarily go into remission, but they may have like a reduction in their depression symptoms, right? Or they may begin to start feeling better, or may now be able to go out to bed, you know, get out of bed and be able to go, you know, maybe have coffee with a friend when they weren't able to do that before. So here's just a glimpse of the TMS results in this private setting. So in this setting, over 95% of the patients treated are done in combination with like antidepressants. So that's providing some relief. So without the side effects, here are some of the centers reported data by age. So as you can see, the response in TMS is over 75%, and the remission rates are above 55% across all age groups. So then I'll talk to you a little bit about the candidates that we're looking for TMS. So of course, we're looking for candidates that have been diagnosed for major depressive disorder, obsessive compulsive disorder, smoking cessation. We treat a lot of patients with anxiety, and we have some really good results at our clinics, and patients that are suffering from fibromyalgia. So we're also looking for patients that are treatment resistant, who have had maybe one or more medication failures. Patients experiencing intolerable side effects from whether it be sexual dysfunction, weight gain, dry mouth, confused thinking. A lot of them may have, you know, weight loss. Some experience, you know, extreme headaches. We want to make sure that we're helping these with TMS. So there are some that have medical conditions or medications that adversely interact with their antidepressant. Those two are some of the candidates that we're looking for TMS. And then, of course, patient preference, you know, in self-paying. As we discussed earlier, insurance is only covering for patients that are suffering from major depressive disorder. It doesn't even cover for patients that are suffering from mild or moderate. But we do know that TMS can help these people. So if they're interested in undergoing TMS and they're willing to pay, then we're definitely looking to help these people. So now I'll talk to you a little bit about mindful TMS and like who we are. So our organization started in 2018. Our first clinic was actually opened in Delhi, India. And then we have currently now, we have 2 clinics in Delhi and 2 clinics in Bangalore. So we're actually, I think, the only international TMS clinic. So we currently have 5 TMS clinics in the Illinois area. We're going to open 3 more, and then we're going to start expanding throughout the Midwest, and then we have green light to expand our clinics in throughout the U.S. So our clinic is only about 3 years old. So here are the 3 elements of the mindful approach. We have the seamless experience, we have the targeted TMS, and we have the personalized care program. And that's what sets us aside from other TMS clinics. So our goal at Mindful TMS is to provide patient experience in which administrative challenges are minimized and the treatment outcomes are maximized. So to accomplish this, we have developed 3 elements of the Mindful TMS. And these are a seamless experience, the use of targeted TMS, and the personalized care program. And I'll briefly discuss those things with you. So our personalized care program, at the heart of it is communication with the patient's network. So in this regard, each of us can support the patient by providing consistent and complementary care. So our goal isn't to replace anyone in the network. So we're simply here to solely provide TMS as an adjunctive form of treatment. And in doing so, we make sure that we take care of the treatment from beginning to end. We take care of the patient from the beginning to end. And as you see here with our personalized care program, what's really important as well is the family and friends. Because a lot of times some of our patients have been depressed for so long that they don't begin to see the changes in their lifestyle, but their family and friends do. Their family and friends will say, hey, we had a good conversation on the phone, or she was on time today, things like that. People don't understand how always being late can sometimes attribute to depression. It can attribute to anxiety because you can't pull yourself together, right? So that personalized care program that we have, we want everybody involved to make sure that we're able to get patients to the next level. And I don't know if we have any psychiatrists or psychologists on the webinar, but what we do here in Illinois is we invite our psychiatrists and our psychologists in on the session so they can see who we are, what we do, and how we interact with the patient. And then that also expands the comfort level, and it gives the patients the opportunity to know that they have a network of people that are working on their behalf. And we've had several times where the psychiatrist, if they're not busy with another patient, or if this is a treatment-resistant patient, they'll make time in their schedule and they'll come to our clinics and sit with us while the patients are doing TMS. So now TMS is covered by all major plans and we're in network with most of the major providers. But as I stated to you guys earlier, TMS is only covered for major depressive disorder. So now it will cover OCD on a case-by-case basis, but we have to fight and kick and scratch to make sure we get that done. So a lot of people are covering for TMS. And this is just our insurance promise. You guys probably don't care too much about that. But in conclusion, so TMS is effective, it's safe, it's approved for the treatment of MDD, OCD, and smoking cessation. There are minimal side effects, it's less invasive, and it's a very well tolerated modality compared to ECT and the psychotropic medications. So the thing that sets us aside is we use the neuronavigation technology. We have our personalized care program. We make sure we invite all of our patients, family, and friends to our clinics because they're the ones who encourage them. Because especially the patients that may have to pay out of pocket, they've been depressed so long that they don't think they're worth the cost. They're like, I've been depressed my entire life. Nothing's gonna help. I've been on 8 or 9 medications. The medications failed. And they don't believe in themselves. So sometimes the family will encourage. So we invite, that's why that personalized care program is so important. So at Mindful TMS, we do all of the heavy lifting for our patients and their families, and we make sure that we're with you from start to finish. And we also give our patients kind of like a patient education because we recognize that TMS is something that's new. So we put together an education that we put for our patients, and we give a presentation to them just the same we would give to the psychiatrist, just so they can have a better understanding of what TMS is and can be comfortable with doing it. And when they're here in our clinic as well, we'll also give them a tour of the technology. So this way they can see that it's not as scary, as they think it is, or what they've read, on the internet. So we recognize the importance of all of our providers, what they play in the patient's care, and we respect and we honor that relationship. And we kind of network together to do those things. So that concludes our presentation. So before we open it up to questions, I'd like to turn it back over to Cindy for some remarks.
Well, thank you, Teresa. That was a very enlightening presentation. I tried to write everything down, but you just went through, you went a couple slides kind of quickly, so I had to scribble some stuff out, but I'll probably get that video right.
Something,
No, that's okay.
Yeah, you can always reach out to me, or you guys, I'll make sure Cindy knows how to get in communication with me. And then if you guys have any questions, you can always use Mindful TMS as a resource for TMS in the future.
I'm glad I came across your profile and everything, and I'm just so enlightened by everything you've said, and I appreciate you speaking to us all the way from Chicago. I know it's on Zoom, but still, I have to thank you so much.
You're welcome. Thank you guys so much for having us. So there are 12 people on here, so thank you guys, everyone. I think you froze, Cindy. Can you guys hear me? Cindy, I think you froze.
I think I see her pop back in.
There we go. I don't know what. Apologize for that. I hope it was still recording.
Well, that's okay. I think it still worked. Sometimes I get frozen up with the Zoom sometimes, so I thought it was me at first. I'm like, can you guys see and hear me? But and then as soon as I said that, then you ended up leaving the room. I was like, oh no.
Yes.
So that was very, like I said, that was a great presentation. Maybe one day in person you can come out. I don't know, it might be a long trip for you from Chicago to come all the way to Detroit or Garden City, but we'll leave that up to you.
Not at all. We do it quite often, actually. We go and give presentations. So yeah, because it's too, like I mentioned earlier, it's also about the education, because even though this has been approved by the FDA since 2008, there's still so many people that's unaware of TMS and the benefits that it offers. So we always go, I've been to San Francisco to give presentations. I've given some in Florida. So once we get the pandemic under control, I would love nothing more than to come to Detroit and give a presentation in person with you guys. And I'll probably bring Marissa with me, and we'll hang out with you guys in the Motor City.
Oh, sounds good. And by the way, before we go to the question and answer comment section of the presentation, later on, could you email me your address so I can send you a thank you card? As well as to the rest of the other team members that showed up as well.
Yes, definitely.
All right, so now I'm going to leave the group open to any questions or comments that they may have. So take it over, guys.
Perfect, thank you. Do anyone have any questions?
I know I have had EMDR before. Because of depression and PTSD, and it's all kind of triggers fibromyalgia even worse. So what correlation is EMDR with TMS?
You know what, that I'm not familiar with. We haven't treated any patients with EMDR for TMS here in any of our clinics, but what I can do is I can do some research for you, and I have a really good relationship with our vendors, and I can reach out to them and see if they have any clinical studies that they have, and I can read up on those and I can share those with you as well.
Okay.
And you are a joy.
Yes.
So is there any place to that provides this service in Michigan?
So yes, there is, and I can find out, I can get a list of those for you.
And
Thank
I
you.
just wanted to say that I know some about EMDR treatment, and it actually has pretty much zero similarities to TMS, because EMDR, you're following that light back and forth, and it's meant to kind of reform your thoughts about the traumatic experience. So what we're doing here is all magnetic and electrical in the brain, and it has nothing to do with the visual aspect or even the traumatic experience that you kind of go over in EMDR.
Yeah, so we don't do any like revisiting of any experiences or talk therapy during the treatment. It's more of like a medical treatment where we're sending magnetic pulses into the part of your brain that's active in whatever we're trying to treat, whether that's depression or pain management or something like that, where we're stimulating the nerve cells with the magnetic pulses. So it's a little bit different.
Yeah, so no concerns about triggering PTSD symptoms.
Yes.
I know in the past, I mean, many of us in support groups, and I've not only this support group, but I've been involved in others. And one of the things that someone has mentioned in the past is, what is it called? Myosacral massage. And I know I did have someone that did that for me and did nothing. So what are your thoughts about that?
So I've never heard that before, but I'm assuming it's massaging of the head. Is that correct?
Yeah.
Yeah. So it's going to be different because something like that is just on the very like surface level, reaching your muscles. It's not actually going to be able to penetrate through your skull and reach the brain. So that's what's so great about the magnetic stimulation, is it's able to bypass your skull, your scalp, all of the things that are in the way between, you know, the outside of your head and your brain. It's actually going to go all the way through there and hit your nerve cells in that area of your brain, and that's what activates them. So you're actually, for the depression treatment, for example, you get 3,000 pulses per treatment. So it activates that part of your brain 3,000 times. So it's kind of the idea of, if you've ever heard of neuroplasticity, which basically means that you're able to train your brain and change the way that it works. So that's what we're doing. So it's similar to like muscle memory. You know, the more you kick a ball, the better you're going to be at kicking a ball. So what we're doing is stimulating and activating parts of your brain in order to make that part stronger and more active. So for depression, it'll be the left dorsolateral prefrontal cortex. For something like pain management, it would be the motor cortex. And so we're training the brain to work a little bit differently and therefore relieve the symptoms of whatever we're trying to treat. Does that make sense?
Mm-hmm. Yeah.
And to go off of what Teresa said earlier about most chronic pain being nervous system related as opposed to actual inflammation or any sort of muscular issue, that's why we won't go into the brain and activate the nervous system, is because the chronic pain is coming from the brain and not from the muscles, if that makes sense.
Yes, so it's going to the root of the issue. There's nerve dysfunction that we're retraining to work in a better way.
So you said that this treatment is 5 days a week for 4 to 6 weeks.
Yes.
So is it just like one set treatment, or would you need to repeat it, or?
Marissa, you can answer that.
Yeah, so like I was saying, it's kind of like muscle memory. So that's why there's so many sessions, is because the more sessions you do, the more your brain learns to be more active in that area that we're treating on its own. So it's 5 days a week for approximately 6 weeks, depending on the treatment that we're doing. And to answer your question, follow-up is really dependent on the person. It can be different. Some people will go years and years and years without ever needing more treatment. Some people might notice their symptoms come back after a year or maybe even 6 months or so. So for that, we recommend coming in for booster treatments. It's kind of just to reactivate that area and get it going again. Some people might need a full nother treatment course. It really depends on each individual.
I had a couple questions, quick questions actually. The treatment, it doesn't have like a lot of radiation, like when you use that coil into the brain. I know it's a silly question to ask, but I was just curious.
No, not at all. That's a very common question, actually, especially when you're thinking of something like ECT, like Teresa mentioned, the electroconvulsive therapy, because that can have a lot of really bad side effects because you're actually inducing a seizure in the brain. This is totally different. Magnetic pulses are really well tolerated. So it goes into the brain without interfering with the muscles, and it's also not inducing a seizure. Where actually the biggest side effect that's been reported is just a headache at the treatment site during the treatment, because you do feel a tapping sensation on your head. But that, even you start to get used to it throughout the treatment course. So it's really well tolerated, and like Teresa said, it's been FDA approved since 2008. So if there were long-term side effects from magnetic stimulation, we would know about it, and there just really hasn't been anything that's come up.
Okay, and one more other thing, maybe Teresa already asked or answered this in the presentation when she was talking about the side effects of medications, you know, weight gain and everything like that. Now, I'm on a lot of different medications. Now, is weight loss, I know she mentioned it really briefly, considered one of the side effects too besides weight gain, or is weight loss with other medical conditions?
As it relates to medication?
Yeah, like one of the side effects.
Yeah, weight loss can be one of the side effects of medications, yeah.
Oh, that could be like from one of the pain medications or antidepressants and things like that.
Yeah, it can be from either one of them, because you never really know how, like, that's the one thing we don't know about medication. You know, you never really know how it will affect you. Like me, I have 2 children. I have 2 boys. Both of my boys have both the same parents, same mother, same father. But when they were infants, one could take Motrin and the other one couldn't. And then the one that could take the Motrin couldn't take the Tylenol. And so he could take Tylenol and then the other one couldn't. So I'm like, you have 2 children with the same genetic makeup, well, similar genetic makeup. So I'm sure one got a little bit more from me or the other one got more from their father. But you have 2 children with the same genetic makeup who can't take the same medications. And you just have no way of knowing why that is. Why the Tylenol wouldn't work for my youngest son when it works so well for my older son. So you just have no way of knowing what that is.
You had mentioned about making sure that the placement was correct.
Yes.
Do you do an MRI ahead of time before the treatment start?
I'll let Marissa answer that one.
So you can, basically, is the short answer, but you don't have to. What we have is a neuronavigation device that includes an MRI database from the Montreal Neuro Institute. So what happens is we take measurements of your head, and our software is able to take a standardized brain that's composed of thousands of different MRI images to create what a common brain would look like. And based on the measurements that we take of your head, it's able to morph that image to fit inside of your skull. And so basically it's like as close to your brain as we can get without actually doing an MRI. And it's shown to be really, really accurate. There might be like 1 to 3 millimeters of a difference, but otherwise it's very accurate. So we can use that so that you don't have to get an MRI, and we're still able to very accurately place the coil where it needs to go and give precise and effective treatment. But if you did want to get your own MRI, you can, and we can just upload that to the software, and that might be a little bit more accurate, but either way, it's just as good. The only reason you might not want to get an MRI is it's sometimes not covered by your insurance company, and so it's an extra thing to pay for. But if that's not a concern, then why not, you know?
Yeah, exactly. That's exactly what I was
If
going
it
to
was
say.
required, then it would be an extra expense.
Mhm. Right, exactly. And that's why we incur that expense for you. That's the reason why we have the database, because not only is it an extra expense, it takes a long time for you to get an appointment to get an MRI, you know, with the doctor. So now you're waiting and you really want to get the treatment, then you kind of lose that motivation. But yeah, it can be expensive. It can be a lengthy turnaround time to get those things. So that's why we say when we want to, you know, do all of the heavy lifting for you, we want to kind of like take some of those things off of your plate and try to do as much of it as we possibly can on our end. Perfect. Do you guys have any more questions?
So regarding insurance payment, did you say that insurance covers it for a diagnosis of depression, but not for fibromyalgia?
Yeah, so it covers only right now for major depressive disorder. So the MDD, not mild or moderate, only for major depressive disorder. It's still in the clinical trial phases for the fibromyalgia. So that's something that is an out-of-pocket expense.
Okay.
I'm glad Dorothy mentioned the insurance question. Do you guys take like Medicare or Medicaid, or I know you accept most insurance, but I don't know how it applies for Medicaid people, you know, people that get Medicaid.
So we take Medicare. We don't typically take Medicaid, because Medicaid is way more complicated than it should be. Because depending on, you know, the Medicaid program that you have, like Cindy, you may have a different Medicaid program for Dorothy, and yours may cover it and Dorothy's won't. And you're like, wait a minute, like Medicaid is so complicated, and it really doesn't need to be. So that's the reason why we don't take Medicaid, is because we can't tell patients, oh, we take Medicaid, but we don't take yours. So it's just not, you know, it's just not worth the struggle.
Oh, that's okay.
Yeah. So do we have any other questions? So if not, then the takeaway that I have here is that, one, I am going to email my address to Cindy, and then two, Dorothy, I'm going to send Cindy a list of some of the TMS treatments in Michigan. So what I'm going to do first is I'm going to reach out to some of our vendors to see who they recommend, because I don't live in Michigan, so I don't want to send you to any place. So I want to find some reputable TMS clinics, and then I will send that list out, and
Thank you.
we can do that. You're welcome. Enjoy. Did Allie and Marissa answer your question about the EDMR? Is there anything you want me to follow up with you on that?
No, they answered what I was thinking. Yes, thank you.
Okay, perfect. So, so Cindy and Dorothy, I will definitely be back in communication with you too.
Oh, thank you so much for coming out. We appreciate you, Teresa. Wonderful, wonderful presentation.
Perfect. Thank you guys so much. And like I said, you can always reach out to, oh, thank you, Joy. How cute. Look at you guys. You guys are awesome. Awesome sauce. Awesome sauce. So I know we're in a different state, but you can always reach out to Mindful TMS with any TMS questions. You can call us directly. Now you've had the opportunity to meet Marissa and Allie. And then you can call either one of our TMS clinics. You can send us a chat on, you know, via our website. And you guys can always reach out to us. We're always here to answer questions for you guys. So thank you so much for having me. It was a wonderful opportunity. Wonderful getting to see you guys' beautiful faces. And hopefully one day I will have the opportunity to come in Michigan and meet you guys in person.
Sounds good, and I can't wait for you to send me the link to the video, because our last speaker last month had problems uploading the video, and he, I guess, I try to get access to it, and there was no way to access it. I needed the person, the speaker's permission, and he couldn't figure out how to fix that. So he was like, well, next time you just have to do it yourself. I said, well, okay, but still, I'm not really too tech savvy. I mean, like, I know some stuff about Zoom, but not everything. So
All right,
that's
well, we're gonna figure it out. And as a matter of fact, I'm gonna try to stop what I'm doing to do that in the next few moments, because once my day gets started, you'll be sending me emails like, Teresa, where's my video? So I'm gonna try to do that.
no, not right away. Take your time. I know you're busy. I was just saying, like, for later on. So
yeah, I know. I'll make sure you get a copy of the video.
all right. Well, thanks again, Teresa.
Thank you. Thank you so much. You guys have a great day.
Thank you, everyone.
You
Yeah.
too.
Thank you, ladies.
Thank you to my
you.
entire team for joining.
Thank you, Jordan.
Bye, everybody. See you on the
Bye-bye.
27th for our next meeting.
All right. Goodbye, everybody.
Bye-bye.